Could the future of anti-aging be hidden in microscopic messengers? Botox might have a new rival. Exosomes are tiny, naturally occurring molecules that can rejuvenate the skin and reduce wrinkles. Today, we will explore the science behind this powerful breakthrough and why it's becoming a serious contender in the world of aesthetic treatments. Hey everyone, and welcome back to the Miamo channel, where we break down the science of beauty, unpacking cutting-edge innovations, and help you to understand what's truly worth your attention in skincare. Let's dive into today's topic: Are exosomes really the natural, smarter alternative to Botox? What are exosomes? They are microscopic extracellular vesicles, tiny bubble-like carriers released by nearly every cell in the human body. Think of them as couriers in your body's internal delivery system. They pick up information from one cell and deliver it to another, carrying proteins, lipids, enzymes, and microRNA that tell cells what to do. They act as cellular messengers, delivering beneficial molecules to other cells. This kind of communication keeps your tissues functioning properly, and in skin, they regulate inflammation, stimulate healing, and maintain healthy cell turnover. Though discovered in 1980s, their application in dermatology is only gaining momentum. When harvested and concentrated in lab setting, typically from stem cells or fibroblasts, they become a potent messengers of regeneration. According to current dermatology research, exosomes help with repairing sun damage, reducing scarring, improving hydration, and prepping skin for treatments like microneedling or laser therapy. Exosomes offer a natural alternative to Botox by restoring skin health on a cellular level. Some researchers call exosomes biological command centers. They don't just deliver nutrients, they deliver instructions. And what's exciting is they reactivate what your skin already knows how to do without adding anything artificial. Let's talk about how they actually work. When applied topically or delivered via procedures like microneedling or injections, exosomes penetrate the outermost layer of the skin and begin communicating with deeper cells in the epidermis and dermis. Once they reach their target, they fuse with cell membranes and release their molecular cargo. That's when the transformation really begins. These signals activate fibroblasts, which are responsible for producing collagen, elastin, and hyaluronic acid, the three essentials for plump, resilient, and hydrated skin. They also help calm overactive immune cells, which can reduce inflammation and improve conditions like redness, irritation, or acne flare-ups. While Botox works by freezing facial movement, exosomes work by retraining your skin to function like it did in your 20s. They are regenerative, not reactive. According to dermatological experts, treatment with exosomes has been shown to increase collagen and elastin synthesis, improve hydration and moisture retention, and reduce fine lines and dullness over time. This isn't just a theory. Practitioners worldwide are integrating exosomes into clinical treatments, especially following laser resurfacing or RF microneedling, to accelerate healing and amplify results. In addition, many dermatologists report evidences that patients notice an improved glow, reduced redness, and overall reset feeling in their skin texture following a few sessions with exosomes treatments. This makes exosomes particularly valuable not just for aging concerns, but also for post-acne marks, melasma, and even general skin fatigue. Exosomes versus Botox, the key differences. Botox has long been a go-to for a quick wrinkle reduction, particularly for expression lines caused by repeated muscle movements like forehead creases or crow's feet. It works by blocking the nerve signals that makes muscles contract. When the muscles stay relaxed, the overlying skin doesn't fold as much, and that reduces the wrinkles. It's effective, it's fast, but it doesn't actually improve your skin health. Botox is great for smoothing, but it doesn't hydrate, firm, or repair skin. Now let's look at exosomes. Instead of freezing the muscle, exosomes restore the structure and vitality of the skin itself. They work on a cellular level, stimulating your fibroblasts, which are cells responsible for producing collagen and elastin. So you're not just preventing lines, you are improving texture, tone, and resilience. Another big difference: how they are used. Botox must be injected, and while it's quick, it comes with a minor risk like bruising or asymmetry if not administered perfectly. Exosomes can be applied topically or delivered invasively through techniques like microneedling or injections that help them penetrate deeper into the skin. This makes them more accessible and gentler for clients seeking a customizable approach. And then there is the longevity. Botox effects typically last 3 to 6 months. Exosome benefits build over time and may last longer, especially when used consistently. They are less about instant smoothing and more about long-term strengthening. To summarize, Botox reduces movement, exosomes rebuild skin. Different tools, different goals. And for many, they actually work beautifully together. The future of exosomes in anti-aging. So why is this such a big moment for exosomes? Because the science is advancing fast and so is the innovation. Exosome-based skincare is already being used around the world in clinics and at home, but we are just scratching the surface of what they can do. Researchers are now experimenting with different types of exosomes, some that are better for boosting collagen, others that calm inflammation or speed up wound healing. There is also work being done on programming exosomes, giving them specific instructions before applying them to skin. Imagine a serum that tells your cells how to fix UV damage, or the one that targets redness around your nose and cheeks with pinpoint precision. And delivery methods are evolving too. From microneedling and ultrasound to next-gen innovations like patches and light-activated serums, we are heading towards a smart skincare. Exosome-based skincare products are already on the market and gaining popularity. Some brands are even experimenting with masks infused with exosomes, aiming for deeper penetration and improved efficiency. As public awareness grows, so does the market, and the dermatologists are beginning to offer more tailored protocols based on age, skin type, and treatment goals. And with more studies confirming their benefits, the future is looking bright. We are not just treating the signs of aging anymore, we are actually learning how to reverse them on a biological level. The wider application of exosomes. And here's the bigger picture. Exosomes are not just changing beauty, they are changing medicine. In neurology, researchers are studying how exosomes could act like a molecular mail trucks. They're being studied to deliver drugs across the blood-brain barrier, which could transform treatment for Alzheimer's or brain injuries. In cardiology, they are being explored to help rebuild heart tissues after heart attacks. In orthopedics, they may assist with cartilage regeneration, offering hope for those with joint degeneration. And in cancer research, scientists are working on using exosomes as smart delivery drones capable of sneaking therapeutic agents directly into tumor cells, while avoiding healthy tissues. As research evolves, some scientists predict that exosomes therapy could become a cornerstone of regenerative health, not just in medicine and skincare, but in sports recovery, organ repair, and even in metabolic disorders. All this makes exosomes one of the most promising tools in both regenerative medicine and aesthetic skincare. So could exosomes be next Botox? Maybe not a total replacement, but definitely a shift in how we think about skincare and aging. The potential applications of exosomes extend far beyond anti-aging, revolutionizing medicine as we know it. Thanks for spending time with us here on Miamo channel. If you found this deep dive helpful, be sure to subscribe for more insights into the future of skincare. Until next time, stay curious, stay glowing, and keep your skincare smart.